Members of the communities die in the hospitals, leaving others afraid to seek medical care. The result, countless deaths. From COVID, from tuberculosis, from HIV. You see, those that missed follow-up dates of previously well-controlled conditions like HIV and TB and other illnesses come in now dying.
We had 5,500 adolescent girls and young women getting newly infected every week. That's a crisis for young girls. We are failing our girls. We are failing young women.
We must ensure, and Winnie has been very articulate on this point, we must ensure that as we develop new tools to fight COVID-19, that these are made immediately available to those who most need them, to the poorest, the most vulnerable, the marginalized. Because the reality is we were shockingly slow to do this with HIV. Antiretroviral treatments were first launched in 1996, and it was only after 2002, with the creation of the Global Fund, that we began to see a scale-up in provision of access to people in the poorest countries in the world. In the meantime, millions of people die. Diseases like HIV and COVID-19 expose the ugly fault lines within society. They expose the inequities, the human rights related barriers to access. We shouldn't be satisfied to leave the fight against diseases like HIV and TB unfinished. These are diseases we know how to beat. So it is a choice that we don't beat them.
The long-term impact of COVID on HIV, that there could be an additional 293,000 new infections because of this disruption in services, because of human rights violations, of lockdowns and so on, and that there could be an additional 148,000 AIDS-related deaths in this year. When we compare the data of last year and this year, we see declines in the number of people coming for testing, in the number of people staying on treatment, showing that people aren't coming up for services for various reasons. So we're going to have declines in adherence. When people don't take their treatment, then their immunity decreases, and then they can even spread the virus, even if they were before no longer spreading the virus because it was suppressed.
My nightmare scenario here is that the Global Fund to fight AIDS, TB, and malaria finds itself also dealing with COVID, but with the same amount of money, in which case we will make less progress on all four diseases and more people will die.
We must use this crisis to make sure that where we were found, we're never found there again. And that takes me to the change that we want. We've been arguing that it is the role of governments to deliver on the right to health. Companies can come in, they can innovate, they can bring medicines, they can build systems, but ultimately, to deliver on everyone's rights to health, you must have governments playing their role. The right to health comes before the right to a profit. We must solve a crisis and then profits can be reaped later. I want to agree so much with Peter Sands, but arguing from a human rights, social justice fighter perspective, and agree with an economist and a banker that this must be a global public good.